And we are live on Facebook.
All right. Hello, everyone. Welcome to the COVID-19 CommunityResources.com town hall meeting powered by the Center for Closing the Health Gap. Your moderators today will be superstar Tropikana from The Wiz, and I'm Vice Mayor Jan Michelle Lemon Kearney. Okay, we've been dealing with COVID for almost 2 years now. So tonight, we have a lot to talk about. Let's talk about COVID, the Omicron variant, any other variants that are out there and that are coming, vaccinations, boosters, and what should we do? How are people feeling? What is going on? When will we be done with wearing masks and social distancing? What is going on? We've got a lot to talk about tonight. Before I introduce our panelists, let me thank our tech team, John Reichel and Lauren Harden. And I want to remind you that we are being taped so that we can replay this episode later on the COVID-19 CommunityResources.com website and on other platforms. Now, if you're already on Zoom or Facebook, feel free to go ahead and start entering your questions, because this is all about you. We want to give you the information you need and give you a chance to express how you're feeling and any issues that are going on with you. So feel free to go ahead and enter your questions. Let me turn to Tropikana to introduce our wonderful panelists, and then we're gonna get right to our conversation. Tropikana, I'm gonna turn it over to you. Let's see, Tropikana I think she might be changing platforms. Let me just go ahead and introduce our panelists, okay? And then Tropikana is coming right back on. All right, so we have Dr. Edje from UC Health. We have Tionna Baker, and she's got a lot to share. And we have DJ J Doe from 101.1 The Wiz. Welcome, everybody. Thank you for being here. So glad you're here. And you guys can unmic. Unless your backgrounds are really, really noisy, it's okay to unmic so that you can jump in. Let's start. Well, DJ J Doe, do you want to just say hi? Do you want to say 1 or 2 words before we go? And then Tionna, I'll ask you the same thing, and then we're going to get right into the info.
Yeah, good evening, everybody. Happy New Year, first of all. Officially made it to 2022. Thank the Lord.
Yes.
So, I just want to say, thank you for having me, and I look forward to the conversation. Got a lot to talk about, so hopefully
we've got a lot to talk about. That's right. Yeah. We're still here with this COVID. Okay, Tionna, you want to weigh in and just say hello to everybody before we get started? Tell us a little bit about yourself. Okay, Tionna. Okay, Tionna might have gone off. It's 2022, but Zoom is still a challenge sometimes. So that's all right. She'll be back. She'll be back. Tropikana will be back. Let's Dr. Edje, I want to go straight to you to tell us where we are. There's so much information out there. What's going on? And I know you have a whole list of questions that Renee Mahaffey Harris gave you earlier that people have already sent in. So, give us the update.
Thank you very much for having me. I'm Lou Edje. I'm a family physician here in town, and I work at University of Cincinnati College of Medicine, and have had my family affected by COVID, and also in the Moderna trial. So I bring those different perspectives to the table. So just as of today, what we've found is that Omicron is going down in certain areas of the country, Washington, D.C., Cleveland, Puerto Rico, those numbers are going down. And in fact, overall in Ohio, our numbers are going down as well, but not in this part of Ohio. We are still going up in Region 6. We are about 2 weeks behind Cleveland as far as their surge goes. So we're expecting the next 2 weeks to be pretty intense. Our hospitals are already full to capacity. We are doing a lot of shifting of people out of their normal jobs in the hospitals into other spaces to help people out, because we've had so many departments that really have had people who are out sick.
Well, let me ask you, so our rates are going up and then there are other places where the rates are going down. Why is that?
Well, so the peaks are at a different stage. And so, for example, Cleveland, it was 2 weeks ahead of us, roughly. And so they have already gone through their peak, the worst of what they're going to get so far. And we're just trudging up that hill right now. So we're 2 weeks behind them, and we'll probably have a peak in the next 2 weeks here.
Okay, and so are we talking about the Omicron variant?
As the main one that's predominant right now, yes.
Okay, so is Delta over, or is Delta?
Oh, Delta's not over yet. We still have Delta, but Omicron is the predominant variant that we're getting.
Okay, and then so my understanding about Omicron, and tell me whether or not this is right, is that it's highly contagious, but you don't get as sick. Like it's kind of like having a cold.
Not exactly. I mean, we're getting fewer people who are in the ICU and vented, but we're still getting folks who are in the hospital. And of course, if you've got underlying conditions, you're still at significant risk. And if you are not vaccinated, that's the majority of the folks that are ending up in the hospital.
And, and so, for a while we were not wearing masks. I mean, we kind of went through a nice period where we felt safe. A lot of us were vaccinated and we didn't have to wear masks. And now we're back to wearing masks. We were starting to go back to events in person, and everybody's like, oh, so glad to be back. And now, just like the MLK ceremony that was held on Monday here in Cincinnati, after the march, the ceremony was actually virtual. So we're back to being virtual. And that's going on a lot. So do we expect this for maybe just a few weeks, or, where are we with this? I mean, it's so frustrating.
Yeah, I'm not sure that a lot of us actually went completely mask free. We were cautiously optimistic that would get to that point, but I think the majority of us, and especially those of us who see patients, we continue to mask, interacting with our patients, as well as when we were in unventilated, closed indoor spaces. So who knows? At this point in time, we still have a surge that is on its way uphill. Right where we are in Hamilton County. And we're not sure what the next variant is going to be. As we've talked about many times before in these town halls, the variants tend to circulate in the unvaccinated population. And so we still have people who are not vaccinated. The concerning thing about Omicron is that we're getting breakthroughs. So folks who've already had both vaccines for the mRNA vaccines, either Pfizer or Moderna, plus a booster, are still getting some breakthrough, but milder cases probably just because they've already been vaccinated.
So is it true then that most people who've been vaccinated and who've had boosters, if they might still get COVID, and that's what you mean by the breakthrough, right? But
absolutely.
But then they don't get really sick. They end up not being in the hospital.
Yes, that's very close to true. Yes.
Yeah, I heard that 97% of the people in the hospital with COVID are not vaccinated.
That's correct.
Okay. Yeah. All right. Well, that's kind of encouraging. And I'm going to ask you some more questions about the vaccination in a minute. But DJ J. Doe, where are you with all of this?
Well, I'm kind of like one of those people that's still like torn between it, because I am vaccinated. It wasn't my choice. Well, I guess it was my choice, but my employer.
I was gonna say, did somebody come to you with this needle?
Yeah, like my employer basically stated that I had to get vaccinated in order to stay employed. So I got vaccinated, and I got vaccinated in November. I want to say it was November. So after I got vaccinated, everything was good, and just last week I had COVID. And it was kind of crazy because it was just like, I mean, I'm vaccinated. So I thought this was not supposed to affect me. Like, and the crazy part about it is that I also had COVID last year, and I had the same effects, the same feelings as if I wasn't vaccinated. So in my mind, I was just thinking, like, what was the point of being vaccinated if I'm still going to get sick? I still had the same effects as if I wasn't vaccinated. All the side effects that came with it, I had them. And even now, like, I still have some type of side effects. Like, sometimes it's hard for me to breathe. And that's just because I also had underlying conditions like asthma. So that kind of affected it as well. And I still have like a cough that'll come, that even though I went and got retested and I no longer have COVID, but it still affects me. And I still had the effects last year. Like last year, I could not really I didn't have my full smell from July all the way until like September. So it's still affecting me in certain ways. And it's just like, what was the point of being vaccinated if I'm still getting sick? I can still pass it to other people. I guess like the only difference that I hear people saying is that now is that it's not as many people dying from it, which is a good thing.
Yeah.
But as far as getting sick and everything, is just like what's the point of being vaccinated if we still passing it around to each other and everybody's still getting sick?
Yeah, just to answer that, I'm just really grateful that you, with an underlying condition, didn't get hospitalized and didn't pass away, because
I did have to go to the hospital.
You actually admitted to the hospital? You were in there several days?
No, I was just in there for just an ER visit. It wasn't nothing that lasted more than a couple of hours, but it got to a point where it was bad where I was like, yeah, I need to go to the hospital.
Yeah, to be admitted, you end up staying overnight. You get moved from the emergency room and you're overnight in the hospital admitted. And what we do know is that folks who have been vaccinated and boosted are much less likely to have a problem. So I'm grateful that you didn't actually get admitted to the hospital and that you are healthy right now, although not back to baseline. It probably would have been much worse had you not been vaccinated.
And
but
I'm sorry, go ahead. No, go ahead.
No, I was saying I still had the same effects as last year when I had it and I wasn't vaccinated.
Yeah,
no, I understand.
Yeah.
But you may have been admitted. You may have been admitted or passed away is the issue that I'm concerned about. You know, at least you still got sick. Yes, understand that. But you know, again, without being vaccinated, you could have gotten worse symptoms than you had before you were vaccinated when you got COVID.
JJ, I wanted to ask you, and I want you to talk about your symptoms too, but which vaccination did you get, and did you get a booster?
I got my vaccination card right here. It's ready. So I got the Pfizer vaccine. I'm not for sure how long it is before I get the booster. I think it's 6 months. I'm not for sure, but I didn't think that it was time for me to get my booster yet. That's why I didn't get my booster shot just yet. And like the symptoms that I had, like at first it started out with a sore throat. I had a sore throat for like 2 days. And then the third day, it was like I woke up and it hit me. Like I had chills, hot flashes. I had no energy. I had no appetite. I was vomiting. I just really felt like this is the end of the world. Like this is how I'm gonna go out. But that night, like talking to my mom and everything, she was like, "You need to go to the hospital." So I went to the hospital and I spoke to the doctor and he was just like, "Yeah, it's COVID." So one thing that I did experience that I've talked to a lot of other people who said they didn't have the same type of results was my doctor prescribed me medicine, and he basically prescribed me promethazine and codeine for my cough. And a lot of people said that they didn't get any medication at all from their doctors. It was just like, well, go home, stay home 14 days and good luck. So that was another thing that was kind of like weird, because I'm like, wow, like nobody got any medicine or nothing, like antibiotics or nothing. But my symptoms were like, they were pretty serious, but they only lasted for 2 days. After the second day, I really felt it on a Thursday and Friday. Saturday, I woke up and I was perfectly fine. It was like nothing at all was wrong with me.
And same thing last year?
Yeah, same thing last year. Okay. It lasted for like 2 days. And the next day, well, it really lasted Friday, Saturday, and Sunday. And Monday, I woke up and it was like I was perfectly fine. Like everything was back to normal. I had all of my energy back. I could eat. I wasn't vomiting. I didn't have no hot flashes. Everything was good, which was weird.
Yeah. Dr. Edge, what about the medicine that DJ J. Doe got? I mean, why did he get that? And, what was that?
Yeah, so that's just to help out with his nausea and the vomiting that he probably had. He mentioned antibiotics. You'd not be using antibiotics for this. This is a virus, and use antibiotics for bacterial infections. And so you shouldn't have expected antibiotics. There are a couple of drugs that are oral, so you can take by mouth. That are prescription, and they're best used in the first couple of days in the very, very early stages. They're usually pills twice a day for 5 days or so. And there's an EUA, so an emergency use authorization for them. So that is an option. You've also got other options, intravenous remdesivir, which is out there as well. And in fact, just a couple of days ago, there was an announcement that remdesivir, which again is usually given IV, can also be inhaled. So that's an option, an opportunity. Hopefully we'll get some more information on that in the next couple of weeks here. But for those who are homebound, that's another alternative option.
Okay, great. Tropikana, our other.
Hey, Jan Michelle, Tionna has joined the call. She's on.
Yeah, I was about to say, Tropikana, do you want to introduce Tionna?
Tionna Baker has entered the building, ladies.
All right.
I want John to introduce all of us like that. That was nice. Tionna is a member of the Cincinnati community, also a caretaker of children, and she also is a flight attendant. So she is joining our conversation as well. Welcome, Tionna.
Hello. So sorry for the delay. I was having so much trouble getting logged in, but I'm here. I made it.
Well, we're so glad you're here. Thank you for joining. We were just, DJ J. Doe was talking about how he was vaccinated and then ended up getting COVID. And this is his second time getting it. So tell us your story. Where are you with all the vaccinations and boosters and getting
Well,
COVID?
I got fully vaccinated last summer. And I actually got COVID in November of 2020. I didn't have a severe case like I hear a lot of people have experienced. And smell, and that was it. I think recently, I don't know. I noticed the spike definitely during the holiday, and thankfully I was out of town, so it worked out. But I'm at the point where I really want to know how this is gonna impact us all long term, especially with just vaccines, every flu shot, and we stay hopeful. I mean,
Yeah, Dr. Edge, do you want to? That's a good question for you.
Honestly, I didn't hear the whole question. I think she was a little choppy there.
She was asking, yeah, Tionna, you were going out a little bit, but she was asking how is this going to affect us long term?
As far as being in the pandemic, or could you rephrase your question?
So what I was asking is really, how do we stay hopeful? There hasn't really been a whole lot of stride made with COVID. I mean, we're still kind of in the same situation we were just last year. And I feel like things are kind of, they're getting to a point where they're even more intense, and, we're not as free as we thought we would be, especially just to move around and go about and just get back to some kind of normalcy. I know that'll never happen again, but I mean, how do we stay hopeful during a time like this?
No, that's a really good question. If you look at the curves, our peak for last December, the December that was December 2020, we've surpassed that right now. Things have changed. We do have treatment that is under emergency use. We have therapies. We also have the vaccines, plus we have the boosters. And so what that has done is effectively decreased some of the serious illness that some individuals have. It's still getting folks into the hospital. And again, those folks who are not vaccinated, it's really a problem. I think the biggest thing for us in healthcare right now is we are still being overrun. People are having to take off, being in quarantine, and they're off work, and then, you know, we're down several folks. One example, at the Cleveland Clinic, they have 35,000 people that work at the Cleveland Clinic in Cleveland, as opposed to the other Cleveland Clinic locations. And they had 3,500 people out at once several weeks ago, which is 1/10, you know, of their institution. Each one of those people had a full-time job. And so just trying to backfill, that has just been really difficult. The other thing, I think previously we had hope because, you know, a vaccine was just come out, and we were hopeful that that would be, you know, the end all. I think what's probably going to happen is that COVID's probably going to be with us in a very low sort of endemic as opposed to pandemic situation down the line. It'll be here, won't be completely gone, but hopefully we'll be able to get to a point where we're not having to do what we're doing right now.
Dr. Edje, explain the endemic versus pandemic.
So pandemic is the entire world is affected by this, versus an endemic thing is something that is constantly there, but it's at a lower level, like the flu, for example. You know, it's something that we can handle. Hopefully it'll get to that point. At this point, it's not there. So
you're saying COVID's going to be around, but we'll be living life as normal, right? And
that's the hope.
Mask. Yeah. Okay. All right.
I have some questions, Jean-Michel, that have been submitted online that I would like to ask, if that is okay with you.
Oh, absolutely. Yeah.
One of the questions that we received that I thought was kind of interesting is from a gentleman named Kyle. He wants to know exactly, how does the booster work?
So the booster actually is, depending upon which vaccine you get boosted with. So the Moderna is actually exactly half of your original dose of your previous 2 vaccines. Pfizer is the full dose of your previous vaccines. And basically it goes ahead and actually gives you a 30-fold increase in the virus neutralizing antibodies. So the antibodies that your body builds in response to being exposed to the vaccine are multiplied significantly. And so that has been the significant benefit of being boosted. Boosted should have a capital B because it does an incredible job to get people protected. So the other thing about boosting is that there's a study that was recently done to look at what if you get a 4th dose. So you've got your 2 doses, you know, let's say Moderna 1 and Moderna 2, and then you get your booster, let's say that's your 3rd dose, you get an additional 4th one. You got a slight increase in protection, but not much as far as keeping people out of the hospital, et cetera. So right now, that's not something that's recommended.
Let me ask you one more to follow up on Tropikana's booster question, because I heard this right before we started talking, that the booster only lasts about 3 months. There's some new evidence that it doesn't last that long. I mean, Dr. Edje, have you heard anything about that?
I haven't got any facts on that. Certainly what we do know is that over time there is a waning of our antibodies. At least that's historically been the case. We'll continue to have more information that comes out the longer we've been out from our boosters. So.
Okay. Tropikana, do you have another question? I see there's some here on Facebook.
I do. Another listener wants to know, is herd immunity even likely at this stage that we are in, with people not going to get vaccinated and still being hesitant about the vaccination and the booster? How are we looking with herd immunity?
Well, let's think about this again. We're still in a pandemic, which means that this is a global situation. And if you think about the number of folks in other countries, for example, the continent of Africa and all the countries that are in Africa, there's just a small portion of those individuals who have been vaccinated fully. And so, you know, when you're down in the 2-3% range of vaccination in a country, and some folks have never even gotten their 1st dose yet, it's just very, very difficult for us to get, you know, herd immunity, meaning that you've got a significant number of people who have got antibodies. We've got to get folks vaccinated, more folks vaccinated, for us to be able to get to full immunity.
Okay. Wow. You know, let me throw this question in from Facebook. So this says, it's kind of, I guess, more of a statement. It's unreal how many people have or had COVID with the shots. Something is not right. The CDC is lying or hiding information about COVID.
So I think that the point that we need to kind of keep an eye on is that Omicron would have been much worse if people had not been vaccinated, because as we know, it's much more transmissible, et cetera. And I think, honestly, if we did not have the vaccines and Omicron was the first variant out the gate, we would be in significant trouble. So while it doesn't seem like it's as effective and people are still having the breakthroughs, it would have been worse without the vaccines.
Okay.
Dr. Edje, we have a question that says, how is COVID affecting our immune system after catching it? How does it affect your immune system long term?
It really depends on the individual and the case that you have. There are all kinds of long COVID symptoms that can occur. The nervous system is one of the areas that tends to get affected significantly for folks. And I think, patients will come in and they'll say, I've got brain fog. And I don't know if DJ Doe had any of those long-term symptoms that didn't go away from your first episode, but it's still yet to tell exactly what the longest term symptoms are going to be, because we're still just a couple of years into this right now. But that is a very good reason to get vaccinated, because if we can decrease your chance of having long-term side effects, that's probably the best thing to do.
This was a two-part question. They also want to know, how does the vaccine affect your immune system? If you could kind of go into detail about that. How does it help or hurt, however?
So basically, it's, if you think about Snapchat, I don't use Snapchat, but I've got a 23-year-old daughter who does. So basically, if you get a Snapchat message that you think about the vaccine as something that is just transiently in your body, enough for your body to go ahead and mount a response. And then that mRNA, especially the mRNA vaccines, the mRNA degrades and it's gone. But it's left this lasting impression on your body where you've got antibodies. Those then are able to go ahead and essentially be an army ready to go ahead and fight the actual virus when it encounters it for real. And so that is one way that the mRNA vaccines work. The other vaccines work a little bit differently, but again, those are the two major drugs that we've got here that we're using.
Let me jump in with this other question from Facebook. And this is saying, why is the CDC requiring that we now wear N95 or KN95 masks? I guess because, for a while we're wearing like all these cute cloth masks and we all had like glamour masks to wear. So why do we have to wear those, like those horrible, I shouldn't say they're horrible, but why do
They are not cute.
They're not cute, exactly.
That's what we wear.
It's hard to make those N95s look cute.
Yeah, so a couple of things. One, when we had the wild type or the alpha variant that was out, we've just noticed that things have gotten more transmissible as we've gone along. So the Delta variant was a lot more plentiful in your ear, nose, and throat region than the original. And then Omicron is much more transmissible. So the issue is, if we're able to go ahead and have a mask that does a better job of protecting us, we're less likely to have that go ahead and get transmitted from person to person. The other thing a mask does is prevent you from doing what you do 16 times an hour, and that is touching your mouth and your nose and your face. We do it a lot more than we think we do, and that is a route of transmission as well. So it just keeps us protected. Again, mainly because Omicron is more transmissible, this masking with the N95s is something that should be more protective.
So, Tionna, let me ask you to jump back in, because you're with the airline industry. How are things going? I mean, I haven't traveled for a long time, but that's your job. So what's that like?
Well, I actually just got back from, can you guys hear me okay?
Yeah.
Okay, so I actually just got back from a trip and like a couple hours ago. And I'll say most people are, they comply with, the mask mandate. We do, however, have people who, I get it. Some people just sometimes forget, and you do get really comfortable when you get on a plane. And I think that's where it goes out of their heads, like, hey, we're in an even more enclosed space. It's like essential now more than ever for you to have your mask. And I'll see like a lot of people, I wish I had a mask right in front of me. I'll see a lot of people, they'll have like just their nose peeking out like nothing. I'm like, you're not helping yourself or anybody around you. And I'm like really, I'm a by the standard kind of person when it comes to my job. So I will walk, I don't care who you are. I don't care if it's, you know, a child, some children who are like, you know, 3 and younger, I get. But what I've noticed is that most of the time it's adults, like it's not even the kids, and they'll just have their nose peeking out. And I'm not afraid to walk up to you like, hey, you know, I need that mask covering both your mouth and your nose. It's for your safety. And I'm not walking around here with the mask just over my mouth. But besides that, I feel like mostly, for the most part, people definitely comply. And I haven't had any horror stories yet. I'm still pretty fresh to the airline industry, but I do notice that more people are becoming more and more comfortable with traveling, especially by air, because there are such strict policies, and they have that sense of security because of those policies and those protocols. Of course, you have those people who are like, well, these don't matter, but it's like in the long run, they do. And it may not seem like it, but they do. I did want to touch on just one of my concerns, especially, you know, like Tropikana mentioned, I do have experience in childcare, and I have lots of nieces and nephews, and they're not vaccinated. I don't have any children of my own, but I know that my sisters and brothers that I've talked to have been hesitant about getting their children vaccinated. And, you know, I just kind of want to touch on that, and maybe you, Dr. Edje, could speak to those parents who may be watching who don't have their kids vaccinated, and you know, give them some insight as to how that could be helpful or beneficial to them.
Absolutely. So a great question. A couple of things. One, if you've got a child who's over age 5, then they can go ahead and get vaccinated. If they've got, you know, specific conditions that you're concerned about, certainly contacting the primary care physician is a good idea. But for the most part, almost every kid can get vaccinated. And the issue with hesitancy, I think, with parents, especially for kids 5 and older, are 5 to 11 mainly, they're concerned about fertility, and, you know, just concerned about, am I going to be harming my child? And I think most parents want to make sure they protect the child, and they certainly don't harm their child now or in the future. And so the biggest issue then to address is this going to affect their ability to have kids down the line if I give my kid the vaccine? The answer to that question is no. And the reason is, especially, so the mRNA vaccines, let's talk about those ones in particular. The mRNA does not have access to the nucleus where your make another Jean-Michel, I'm in Kearney, is going to be. So your DNA lives in the nucleus. Your mRNA does not have access. mRNA in the vaccine doesn't have access to those spaces. So that's why people are very comfortable, physicians are comfortable recommending the vaccine to pregnant women. It doesn't cause a problem with the fetus, and also children. And the other thing that is more practical is, you know, if your child is not vaccinated and they get exposed, then you as a parent are going to be taking time off work because they're going to be in isolation, or you're going to be paying for them to be, you know, somewhere. Most childcare is not going to take a child, you know, who's in isolation. So again, it's right back at you taking unexpected time off of your work. So just from a practical standpoint, as a parent, getting your child vaccinated is important. And then you think about all of the long-term effects that we really haven't got a full handle on. Just because we haven't been that far into the pandemic yet is a problem.
Tionna, do you have any idea why your family members don't want to actually vaccinate their children?
This is something I hear a lot. It's mostly because they don't know the long-term effects. And that's the biggest reason a lot of, you know, just my sisters and known brothers won't get their kids vaccinated.
So just to counter that, the long-term effects of COVID are the things we don't know. The long-term effects of the vaccines, we do know. There's a couple of different issues. When we go ahead and have vaccine trials, for us to be able to present that data to the FDA for emergency use authorization or approval, there is a period of time that we've gone through significant testing, phase 1, 2, and 3. And we have, it's trials in animals and trials. There are all kinds of things that have been done in the past in the trial to make sure that this is okay. It's also usually out for at least 6 weeks before we go ahead and actually submit that information. And most of the things that are long-term problems will actually end up from the vaccine will end up showing up within that first 6 weeks. And so, we had the EUA for Moderna in December, like December 16th. There was a period of 6 weeks or so before that they were done with collecting all their data, and they're just waiting to see if there's any additional issues that were going to come out, and there weren't. So that's the main thing. The other side, though, is not knowing what's going to happen with the long-term effects of COVID itself. We already know that people are having ongoing issues with COVID who were not vaccinated.
Yeah, DJ Joe, you were talking about are you still having smell issues? You said there's still some long-term effects you're having.
Yeah,
Not from the vaccine, but from actual having.
Right. For the first time that I had got COVID, which was last July, I had lost my sense of smell. That was my main sense that I really lost. And it really didn't fully come back until around like the end of September. Now, after the second time I had COVID, I think now it's just my breathing. Like at times, like I can tell it's affected like my breathing, because some mornings I wake up and my chest will feel tight, so I'll just take my inhaler and everything like that to help me. And then usually it'll be okay after that. I'm not for sure if that's just one of those things that just affecting my underlying condition, with that being asthma, or if it's just like something that happens with anybody who just has COVID.
Much more likely to happen because of your underlying asthma.
Okay.
Mm-hmm.
Dr. Edje, go ahead though.
I will say this though, like even about the vaccine, like I feel like that we will eventually get to a point in the world where you'll have to be vaccinated to go anywhere. So I've like just explained to my friends, like, hey, I know you probably don't believe in it, but it's getting to a point where you're gonna need a vaccination card to go anywhere. So you might as well just get vaccinated right now, get it out the way, and keep it moving. And what's so crazy is that like a lot of them are seeing it, because certain cities and certain states is like, yo, you can't even come into this restaurant if you don't have a vaccination card. Or even a lot of places here, like I know for a minute, the new music venue downtown on Riverfront, on the banks, they were saying like you can't come in unless you have a vaccination card. So it's really getting to a point. Like another example, like I plan on going to Canada later this year, and you can't get in Canada without a vaccination card. So it's to the point where it's like, just get it out the way, bro, and just keep it moving. It's like, how did it affect you? Like, it didn't affect me. Now, granted, I was one of those people who were against it.
Why is that though? Tell us about that. Why were you so against it?
Because I just felt like it really didn't. I'm still one of those people who still like am iffy about it, but it's just like,
he didn't have a reason, Jim Michelle.
No,
I'm sorry.
my reason,
I hate to interrupt him. He didn't have a reason.
It's because if you can still get sick and we can still pass it around to each other, then what is the point of getting vaccinated? But what really made me, like I said, what really made me.
Dr. Edje has an answer for that.
Mm-hmm.
Oh, okay, go ahead, Dr. Edje.
You can finish.
Because we've been fighting about this for like
so we have over 800,000 people who are not on this planet Earth, and it does not pick and choose who it's going to take. You can be a healthy guy and a bodybuilder, and you can be this and you can be that, and it can take you in a hot second. So you're playing Russian roulette, essentially. I'm gonna die every single day from COVID. Yes, today. Like a month and a half ago, it was 1,000 people. The last time I did this town hall, it was 1,000 people. Now it's 1,800 people that are dying every single day from COVID. And one of those people may be somebody who usually sits at your dining table. It may be somebody who you work with. It may be something that somebody you care about. Maybe one of your family members. And so those are the reasons not to take chances. Having lesser disease and not being in the hospital, all of those things are huge benefits as to going ahead and getting the vaccine itself. Even that, having to take time off work. You said fearing for your life. You weren't sure if you were going to make it. That's a terrible thing to go through. To have that.
Dr. Edje, I do have a question about those numbers that you just stated about, because me and my friends, we talk about it a lot, and I've even heard stories about it, that the numbers for people dying of COVID are being boosted, because a lot of people will say, like, I've heard stories of people saying, like, they had a loved one who passed away from cancer, but they may have contracted COVID during the time of their passing, so they're just naming it COVID when really they passed away because of cancer or any other disease. Or I've even heard stories of people who were murdered and they say, like, yo, they died of COVID, and the hospitals were naming it, saying that they passed of COVID to just add to the numbers. Do you know anything of that, or do you?
Yeah, so I fill out death certificates as a physician. That's one of my jobs as a primary care physician. And we do need to say what the cause of death is, and then we need to say secondary to, and all the other conditions that were happening at the time that the individual passed on. As you know, the pre-existing conditions that can make COVID, you're much more likely to get COVID, to get worse COVID, et cetera, et cetera. So that is something that is definitely kept in mind. There's no reason, just think about it. What is the reason that doctors would inflate the numbers? Why would I put down that my patient died of COVID if they didn't? There's absolutely no reason that I do that.
You
There's
don't
nothing
get paid extra for that. You don't get paid extra for that, do you? Just to clear that.
There's absolutely no benefit, none. And we take an oath. We take an oath, to first do no harm. It does harm to the patient's family. If somebody does some sort of fabrication like that, there's no reason. It's just against what doctors would do. There's absolutely no truth to that whatsoever.
Also, I think the numbers, and this isn't for deaths, but just the number of people who actually have COVID, we probably don't even have the numbers that are as high as they are, because a lot of people are taking.
I would agree with you. I would agree with you. I think
they don't tell people I've got COVID. You just know you have it and you quarantine yourself.
Yeah, I think you are right. I think we're underreporting numbers. I also think that one thing we are not doing as well as we should here in the United States is actually typing, because a lot of people get tested and they don't know whether they had Delta or Omicron or anything else. They just know they had COVID, and it's 5 days later and they're like, I'm better and I'm back to work, and they don't know. It's because it's expensive, but I think that that's something that would be helpful information for us to have.
Absolutely. We have another question, and I kind of want to know this myself. Following along with them both, I believe that I contracted COVID in December, and I've been battling myself with pneumonia the last week and a half. The question that we have is, why is it that people tend to catch pneumonia while having COVID? And how long is the recovery if you do contract pneumonia as well?
Yeah, so COVID affects multiple different organs. In fact, just about every organ system in your body can be affected by COVID. The mode of entry is usually breathing it in. And so, depending upon the variant, most of them are affecting the upper respiratory tract and the lower respiratory tract as well. If you get pneumonia, it just depends on what else is going on with that. If your defenses are down, you can get a superimposed bacterial infection on top of that. And that will change the course of, how long you actually have that as well. But usually it's 7 to 10 days of antibiotics. You start off with IV and then they wean you down to oral. But your recovery period can be weeks and up to months to get completely back to better. And depending upon what your underlying lung conditions are and your underlying immunity, that can also change how long you're going to have an effect from that.
Absolutely. Go ahead, Tionna.
No, go ahead. I kind of just have some questions about what you're asking. So go ahead.
No, that was fine. Go ahead,
Okay.
ask your question, because I had another question about kids. Go ahead.
Okay, me too. But before that, I do have a question as to, so I was faced with either, going to the hospital. Okay, me and Doe are together, right? So when he got sick, I got sick, and I didn't have COVID, but I still had the same symptoms he had. Like there was no actual coronavirus virus detected inside my body. So, I didn't go to the hospital like he did, but I had the same symptoms, kind of felt the same as he did, and almost in the same time span. And my biggest reason for not going was because one, I already know that I'm just experiencing some of the things that you got, though it's not COVID.
Is there something faster than that? I have that same question, because when Braylon had COVID, although I was fully vaccinated and my test came back negative, I experienced every single symptom that he received by being in the same place with him.
Mhm.
Dr. Edje, we kind of don't discuss that, where you might not test positive for COVID, but you still experience all of the same terrible symptoms. What is that? Is that something common that people are seeing?
Yeah, so a couple of things. The testing type does make a difference as well. So what we do know is that people can transmit it when they're asymptomatic. We do know that you can have a home kit, for example, that is a little bit different as far as how sensitive it is. And so when you're asymptomatic, just starting with symptoms, you're much less likely to get a test that's going to come back positive. So they always do recommend, if you're still symptomatic, even though you had a negative test, to go ahead and repeat the test in a day or so. So that is still something recommended. So I think a lot of times what people are doing is potentially missing an opportunity to retest and come up positive with the retest. Again, because it may have been too early.
So you're really saying Tionna might have actually had COVID?
It's very possible.
Okay, just to follow up with that, what would you say to people? Because, I'm transitioning into a new career. So with that, I'm not getting paid as much as, I was with previous jobs that I've had. What would you say to people who are facing financial problems? Who are like, I really don't, I dealt with this. I'm like, I don't know if I want to go to the hospital because I know what they're going to tell me. I know what they're going to prescribe me. And then I'm left with this bill. What would you say to those?
Yeah, so two things. Number one, get vaccinated. That is free. So that doesn't cost you a thing. That's the first thing. Secondly, get your mask. And number three, I'd actually go ahead and go to covidtest.gov and order, just like I did. It's so easy, it took nanoseconds. I just typed in my first and last name, my address, and my email address, and I've got 4 tests that will be coming to my house within the next 7 to 12 days.
Mm-hmm.
Get your test that you can do at home. There's guidance at the CDC to how to handle if you get a positive test, if you get exposure, etc. And you can do a fair amount of that at home, unless your symptoms get to the point that there's a problem. But you need to be able to follow specifically the directions. If they say isolate for 5 days and then get retested, and only go back if you're symptom free for 24 hours after that, then pay attention to those guidelines. Otherwise, you'll be in a cycle where you may be infecting others in your home and then reinfecting yourself and so forth. So, yeah. So again, the vaccine is completely free. The booster is completely free. And those things are things that can really protect you the most. Of course, keeping your immune system up as well, good sleep, good food, all of those things. It's covidtests.gov.
Thank you.
Let me ask you this question, and then I want to get back to what Tionna and Tropikana both mentioned about children. But here's a question from Facebook, which I'm hesitant to answer because admittedly, I was down at the stadium Saturday with 66,000 people.
Oh.
Yeah, I know. But this question said, should we attend football or basketball games, clubs, or large gatherings? It seems like a lot of people who it seems like there are a lot of people who may or may not be vaccinated.
I'll just tell you what I'm doing. I'm not. I'm a football fan. Oh my gosh, I am a complete fan. Go Blue. I went to Michigan for med school and I got a second degree from there. And you catch me in a stadium any day, the Big House. I didn't go to any of the Big House games this year. I watched from the distance in the coziness of my safe and COVID-free home. I will go back to football games when time's right and time's ready. It's just not a necessary exposure. You know, I get exposed to patients all day long when I'm, you know, taking care of it. That's part of my job. That's a necessary exposure. It's what I do. But why would I go ahead? You know, it's like, you know, I'm not going to go ahead and watch ER on my breaks because it's back to work again. It's unnecessary exposure, right? So.
Great. Okay.
I'm back outside. That's how
That's how you got it.
Yeah, that's how.
That's right. We know you're outside.
but that's also how I make my money though as well. So it's hard to not be outside. Like, but I do take precaution.
Yes.
I do wear my mask while I'm DJing. It's still elbow bumps to people. Like, I'm still distancing myself from a lot of people. So it's not like I'm just out here in everybody's face like, but I'm back outside.
Don't forget to get boosted when you can. So you're fully protected.
Yeah. So, and which I plan on doing.
Good.
And like I said, like I'm back outside, but I do see just by being in the clubs and stuff like that, it's crazy because working in the clubs and the nightclubs, a lot of people will come to the club with their mask on. But as those shots start to hit them, that mask comes completely off.
Yes, that's
and it's crowded in there, right?
That is a super spreader event every Saturday.
It's just not necessary. That's I mean, for you it is, but for me it's a voluntary situation. It's not necessary at this point. I mean, take your precautions, wear your mask, social distance best you can. That's all you can do.
Oh my goodness. Well, okay, let's talk about children. And Tionna and Tropikana both touched on this. So now 5 and up can get vaccinated. What are we going to do about the little kids?
So little kids can wear a mask down to age 2. Okay. So also all the adults around them that can transmit stuff to them, especially Omicron, should be vaccinated. That protects the kids. Helping the kids not to, you know, you see the COVID kids are like, don't touch me. You know, when another kid comes to want to hug them, that's okay. That is fine. Make that normal for now, you know, and have processes in place where you've got wipes that are in the car and, you know, you've got processes to wash the hands and that you're washing the hands for the full 20 seconds, sing the birthday song twice. Those are things that can help kids get into the habit of doing things that are safe for them and their family.
Well, how soon before little kids under 5 get vaccinated?
I would expect it's probably going to be sometime in the spring that we should get more information on that. They started testing kids who are 6 months and above months ago. So, you know, they should have a good amount of data that's coming forward, but yeah. We get vaccines to kids at birth right now. Nobody's bothered with that.
Right. Y'all don't care about that polio vaccine at all. It's this COVID one that's got the world shook up.
Right. Everybody's afraid of it. Yeah.
And Jen Michelle, I just kind of want to share this. We all talk about Braylon. He pops up on this live often. I'm so sorry, Renee, for that. I'm doing my best with that.
We love when Braylon pops up. Are you kidding?
However, he contracted COVID in November. And as a parent, I will say that his symptoms having COVID were much worse than him getting his first shot with the COVID vaccine. So for parents who feel, and I'm sure that it's different for every child, but my baby has congenital heart disease. So I was probably the most hesitant in regards to getting him vaccinated. He got his first shot. He went to sleep, which was actually a break for me. So parents, just a quick little tidbit for you. If you need your kid to take a nap, take them to go get their vaccination. He got his vaccine. The worst that he did was cry because he's drama like his mother, and he would sleep shortly after that for like 3 hours. It was amazing. So just want to share that with you. We haven't had any issues there. He hasn't grown a third leg or a tail. He still talks too much. He's still eating me out of a house and a home. He's fine. And his symptoms from COVID were much worse than anything I experienced with getting him his first shot of his vaccine. And I'll update you on the second one. If you have questions, you can hit me. I'll tell you all about it.
So tell us about his symptoms, Tropikana.
During COVID,
Yeah, during
Really,
COVID.
he did not lose his taste or smell. So this is something that I really kind of want parents to really drive home. We all were taught that, you're going to lose your taste and smell to identify it. And he didn't. He was fine. He just had a really snotty nose and a cough that was progressively worse. And I just knew it wasn't COVID because I've been on the panels with y'all and I'm a doctor now. And you didn't lose your taste or smell. So you're fine. It's not COVID. And lo and behold, it absolutely was. It started there and then it progressively got worse. We had some really hard nights with mucus in his chest and him having really hard time breathing at nighttime. After his quarantine was over, he still wasn't cleared because of his congenital heart disease. He had irregular heartbeat afterwards for a while. So we had to have him monitored and go get EKGs. Am I saying that right? I say the letters wrong often.
No, that's perfect.
Okay, EKGs. We had to go get that to keep him monitored. And he just was kind of on a high alert afterwards. And that's just the one thing that I think that outside of getting tested or getting vaccinated for yourself, it's really for the other people that are around you. You might run into my son or someone else's son who has the same underlying symptoms and you don't have your mask on and you are in full health and you don't care, but it's my child that you could kill or your grandmother that I could kill or something. And I think that we really have to get back to that place that we were when we began with COVID of being accountable for each other in the community around us. If you don't want to do it for you, do it for your mom, do it for your cousins or your nieces or nephews or the people that you want to come to the club with you though, since you got to go back to the club. At least get vaccinated so you don't kill them so they can come back next week.
You know what? That is a great commercial right there. We just cut that and just play it everywhere to everybody, and then we'll just end by saying we must save us.
We must save us.
Save us.
Right now.
Guys, we're running out of time. Renee's going to come on in a minute to give us final remarks. Does anybody have any final remarks they'd like to make before we go to our fearless leader, Renee Mahaffey Harris?
Get boosted.
Get boosted. All right.
We need that on a shirt.
We do.
Yeah. DJ J Doe, are your friends, convinced now? What do you think?
A lot of them are not convinced, but they going to get it because they want to get back outside. So they like, I mean, if I gotta get vaccinated to be outside, let me just go get it. Yeah. So everybody, we all getting our cards, so we're gonna be a part of the card club.
All right.
And
we in the VIP with our vaccination card. You can't sit with me if you're not vaccinated.
That's right. That's right. Tionna.
I just want to say to anybody who has any doubts about the vaccine, take that chance on your life. And especially if you have children, take that chance on your children's lives. I'm quite sure it'll work out better for you if you're vaccinated versus if you're not.
Absolutely.
Right. Okay. And I see Renee Mahaffey Harris is on. Renee.
Hey, so I want to thank everyone for joining today. Jado, Tionna, and of course, Dr. Edje. And I want to thank our moderators, Tropikana and Vice Mayor Kearney. All I can say is we must continue to work to save us. I think your point about us taking it very seriously like we were about a year ago and really being concerned about each other is what we must do. You can get your test at covidtest.gov. I signed up too. It was very easy, very quick. And also if you have questions, we have many town halls to watch. We have many pieces of information to help guide you if you get COVID. We have a new section we're adding about what you need to do if you have COVID, if you have to go to the hospital. And so go to COVID-19communityresources.com. And I pray that we each work to be reminded that we must save us and we must do that together. Grace and peace to all of you.
All right.
Thank you.
Congratulations,
Jan Michelle, Vice Mayor Kearney.
Yeah, congrats.
Love you guys. Thank you. Stay healthy. All right.
Bye, guys. Bye, everybody.
Bye.
Renee.